Hello everyone, it's Haley and I'm back with another pregnancy update. So today is June 29th, 2020, and I'm at the 32 and 5 day mark today. I am going to my doctor's appointment tonight, and this appointment's gonna be a little different than the ones that I have had in the past. The ones that I have in the past is your standard your standard doctor's appointment where you just go and you speak to your doctor, you get your blood pressure, weight, etc. But this one's going to be a little bit different because this is the first week that I'm going at the every 2 week mark. I was there a couple weeks ago, and then I'm also getting an NST, which is a non-stress test, and then I'm also getting an ultrasound, and I think it's called the AIF. It's where they measure your baby. And I'm not exactly sure if the reason why I'm doing this ultrasound in the third trimester is because I'm high risk. I asked my sister if she had to do it with her daughter, and she was high risk with her daughter, and of course she did have to have this ultrasound. And then I asked my other friend if she had to do it with her daughter as well, and of course she had to, and I forgot that she was also high risk. But my cousin, who is having a son, did not have to do this ultrasound. So I think it's because I'm high risk because of my blood pressure prior to pregnancy. Again, if you watched my last video, I explained to you that my blood pressure has been phenomenal this whole pregnancy, knock on wood. I hope it continues to stay that way. I don't want preeclampsia or HELLP syndrome. And, but yeah, so my blood pressure has been great my whole pregnancy so far. And yeah, so tonight's appointment's gonna be a little bit different. I'm doing the non-stress test for the first time tonight, and that will last an hour. So my appointment is at 3 o'clock, and from 3 to 4, I have my non-stress test. And they told me that the reason why it's an hour long is because we don't know how active baby is gonna be for the very first time, and it's kind of just to see like where she's at. So every appointment from now on, I will have to do a NST prior to meeting with my doctor. So my plan is when I go in for the NST, I'm pretty sure that I'm gonna be in a room by myself for the most part. So I will just kind of like record a little bit, show you like what they're doing and what's going on. And then I will give you a little bit of a rundown after my appointment tonight and let you know what exactly was going on, what they were measuring, what they were looking for, and stuff like that. So if you are also doing an NST and you don't know what to expect, then you'll be able to kind of expect what I will be going through tonight. Another thing is I will definitely be updating you guys after I have my ultrasound. Again, I've never done one of these ultrasounds before, and I'm pretty sure that I have to have it done because I am high risk pregnancy. And so I will give you a rundown on the ultrasound as well. That way, if you are high risk or have to have this ultrasound for some reason in your third trimester, you will kind of know what to expect and how long it takes. They told me that the ultrasound typically takes 15 minutes, and they will literally tell me the percentile that my baby's in, if I'm having a big baby, a small baby, a completely average baby. The last time they measured my belly, they told me that I was completely average. I was in the 50th percentile, but the doctors also told me that obviously your baby grows so much at the end of your pregnancy, so we could end up with a bigger baby. So I will let you guys know what my doctor tells me this evening after my ultrasound. I will update you guys all after my appointment tonight. I wanted to talk about a couple of the things I've been experiencing within this last couple weeks of pregnancy. I can definitely tell that she's putting a lot more strain on my body. My back hurts all the time. I had sciatic nerve pain prior to pregnancy, not all the time, but now it's can be extreme pain to where I can't even like lay flat on my back, which I know that they say you shouldn't really necessarily be laying flat on your back, but a lot of times I just do it for a little while just because it's comfortable for me. However, it's not very comfortable, so I haven't been laying on my back. A lot of times when I'm laying on my couch, I kind of slouch, obviously, because I'm just relaxing. And when I get up, I notice even more severe sciatic nerve pain. My doctor told me last time I was there that it might be a good idea to start doing third trimester prenatal yoga type stuff. And I thought it was a great idea and I really wanted to start doing it. But I'm gonna be completely honest, I'm being completely lazy, and I just decided, like, I screenshotted different yoga techniques that I need to be doing, but I just am too lazy to do it. And I should really start doing that because they told me that it would be really good on my body and my joints and my bones and stuff like that, and it would help me whenever it's time to give birth as well. So that's just some advice that my doctor gave me the last time that I was at my appointment, and she told me if I was experiencing any discomfort, that yoga was a really great alternative to try to relieve some pain in a natural form. Another thing I've been experiencing, which I've definitely been experiencing this almost my whole pregnancy, is every single time I eat tomato-based things, like red sauces, particularly everything tomato-based, I have really bad acid reflux. So I make sure that if I eat something with red sauce, that I'm constantly taking Tums right after I eat, and that prevents the acid reflux. Because I had an incident the other night whenever I was sleeping. I didn't know that it was possible to like throw up in your mouth while sleeping, and I did that, and it was disgusting. And once I took Tums, it relieved that right away, and I didn't have to worry about that anymore. So if you experience acid reflux with certain foods, I recommend just having Tums bedside, or just prepare yourself and take the Tums right after you eat it. I know that some people have it way more severe and they have to get prescribed certain medications. Definitely speak to your doctor about that, because if you're suffering, there's medications that can help you relieve that, and there's no point in suffering whenever there's an alternative to help relieve that pain. Another thing that I've also been experiencing, which is totally bizarre to me, is that when I go to bed at night, obviously I have to get up every couple hours and use the restroom because I drink a lot of water, especially during the nighttime as well. But when I wake up in the morning, the bottoms of my feet, particularly the balls of my feet, hurt so bad. And it makes me wonder, like, why, because I've been off of them all night. But that's something that I've been experiencing, and it's probably just because I have the extra weight of a baby in me. But so the best thing that I've been doing for that is conning my husband into like squeezing my feet and like kind of giving me a foot massage every so often. It just relieves some of the pain, and it's kind of like one of those things where, like, when something hurts and you like squeeze it and it hurts even more, that it feels so good. It's kind of like that, as weird as that sounds. I know a lot of you know exactly what I'm talking about, but he's been doing that and it's been helping a lot, and it just relieves that pain temporarily. I mean, it always comes back, but then you just keep repeating what you've been doing. I also haven't been experiencing very swollen toes and feet and kind of ankles. And this past weekend I went camping, so I was in the heat a lot. So I had an anti-gravity chair that I was in most of the time that I was there. And for part of the time I made ice packs and I actually put them on my feet, and that helped relieve a lot of the discomfort that I was having with my swollen feet. I have had to where my ankles are very swollen to where they hurt. So I just put either compression socks on, I do have those, or I obviously like lay with my feet propped up. I elevate them to where they're above my heart. Swelling significantly goes down. So if you were suffering from swelling, that's something that I've also been doing, is ice, compression socks, elevating my feet, trying to stay off of them. Not overworking myself and being on my feet often, like for long periods of time, and definitely taking breaks. That definitely does help. But if your feet do get really swollen, you should probably consult with your doctor, because that could be preeclampsia, HELLP syndrome, and those are definitely two things that you do not want. HELLP syndrome can be extremely dangerous. My sister had that with her first pregnancy. She gave birth to her son at 34 weeks. In a couple of days, I think it was 34 and 4, and HELLP syndrome is extremely dangerous. It's like preeclampsia, but way worse, and it could have potentially killed her and her baby. So if you are experiencing like headaches, a lot of swollen limbs, definitely consult your doctor right away and get that looked at and checked out, because you could prevent something extremely devastating to happen. Another thing that is completely bizarre to me is that with my ankles swelling, whenever I touch them in certain spots, it feels like I have a bruise. And again, to relieve some of that pain, I just ask my husband if he'll like squeeze my ankles, because for some reason it's a lot different than when I squeeze my own ankles compared to when somebody else does it. It just feels so much better and I'm able to relax a little bit. And he's more than willing to do that. And I'm very thankful for that. And one last thing that I wanted to talk about is that my baby has been extremely active. She is a wild child already. Last night we were laying in bed and it was really funny. On the left side of my belly, right next to my belly button, it literally looked like she was punching out. It was just like this little like triangle that like kept punching. And I'm pretty confident that she's head down in the natural position that she should be. And the reason why I say this is because when the last couple times I've been to the doctor, they've already told me that she's head down. And I think she's moved even more, because when I move a certain way, like for instance, a lot of times she'll be like here underneath of my rib cage and it's uncomfortable. So I just like do this and then I can feel something down lower, like, and I'm pretty confident that she is straight down. So, which is good for me that she's in the proper position that she's supposed to be when she gives birth. Okay, so I just got to my doctor's appointment. The first thing that I have to do is a non-stress test, and that's in roughly like 10-ish minutes, so I need to get in there. But then after I do that, I am doing the ultrasound, and then I meet with my doctor, and I have a few questions for her that I will update and fill you guys in on in a little bit, so stay tuned. So I just got home. I had my appointment with my doctor, and I had my NST, and I also had the ultrasound. So I'm just going to update you guys a little bit on what all of those entailed. So the first thing that I did was an NST, and that's a non-stress test. And what they do is, I will show you guys real quick. They give you these bands, and these bands are what I'm gonna have with me whenever I go to the hospital. So I have to keep these for like every single time I have an NST. And then whenever I go to labor and delivery, I'll need these as well. But they put these bands around your belly, and it's them monitoring the movement of the baby. So they have one that monitors the movement and one that monitors the heart rate. And it's like these little like circular things that you're able to use the bands, and they hold them in place. And then when you have your NST, they do that. And then they also give you a button to push. So every single time you yourself feel your baby move, you click the button, and you can click it as many times as you feel the baby move. And it just kind of keeps track on what you feel, but it also tracks when your baby moves as well, without you actually like pressing the button. So when I was doing mine, the woman who hooked me all up was talking to me the whole time, and she's like, did you feel that? And I'm like, honestly, no, but I'm not paying attention. Like, I'm talking to you. And she's like, okay, I'll stop talking. So and then I was able to I was laying back, and I ended up moving up a little bit, and then I could feel her move more. I don't know if I just like couldn't feel her move, because sometimes like I'll look at my belly and my belly's moving and I can't really feel her, or if it was just the bands that were like compressing on my belly and I couldn't feel her move. I don't know what it was, but my NST took me 15 minutes, but by the time I got in the room, got hooked up and ready to go, it was kind of like a long process. So the 15 minutes kind of like flew by. I also took a couple videos that I'll insert here, and it just kind of shows you a little bit on what the NST was. So here are those videos. All right, and then the next thing that I had was my ultrasound, and that was measuring the fluid, like my amniotic fluid. And the reason why they did that is because I'm high risk, And typically with a person who has high blood pressure, they expect your fluid levels to be low. And it also, they took measurements of the baby, and they expect the baby, since you have high blood pressure, to be on the smaller side. Not the case for me. My fluid levels were perfect, and she's actually kind of a large baby right now. She actually I know that they are give or take like a couple pounds, but as of today, I'm 32 weeks and 5 days. She was measuring 5 pounds, 4 ounces. So that's a large baby, especially if I have about 7 weeks to go. That's a large baby because they gain like a pound like every week. So, but again, the ultrasound is just like give or take a couple pounds. And yeah, so she looks really healthy. She's head down. And it was really cool to see her again because I haven't seen her in a while. So the last thing was that I met with my doctor, and my doctor just kind of like asked me if I had any questions this round and measured my belly to see where I was at. And I had asked her because the ultrasound sonographer forgot to tell me what she was weighing. So I asked my doctor, I was like, does that paper say what she like was estimated at weighing? Because she forgot to tell me. She's like, yeah, she's weighing at this weight. And I was like, oh boy, that's a big baby. And she's like, yeah, but you're healthy and what you're doing is fine and all that good stuff. So I'm healthy, baby looks healthy. And then my other question was that since I'm high risk, will I be induced? And she said that typically with a person with high blood pressure and since you're high risk, they do tend to induce that person at 39 weeks. As long as the person is okay with that. And I told her that I'm just going with the flow and I'm okay with whatever my doctors suggest. And yeah, so instead of her coming August 19th, she's probably going to be here before that. And they might not induce me. She might come on her own, but at the same time, she might not come on her own, and then that's when I'll be induced. So, if you ever have any questions in regards to if you're going to be induced or anything, just ask your doctor because they know your body, they know your baby, they've been monitoring you the whole pregnancy. They'll tell you what you need to hear. It's not what you want to hear, it's what you need to hear. And I'm pretty much the type of person that I'm just going with the flow. So if they want to induce me, I'm completely fine with that. If they didn't want to induce me, I would also be fine with that. I'm just going with the flow. I don't have a birth plan at all. I'm going with the flow. Like I have things in mind that I want to do and things that I don't want to do, but sometimes I don't get what I want. So we're just gonna have to go with the flow. So yeah, so there it is. And yeah, here's a really cute clip of my baby breathing.